All right, now for more on those discussions, I'm joined by the Health Minister who was there yesterday. Minister, good morning and thank you very much for your time. You know, the scenes we saw yesterday of clashes between Dudula and EFF members were honestly disturbing, but more so because of their location. A hospital should never be a site for clashes. What did you honestly make of that when you arrived? Minister, I don't know if you can hear me. Perhaps you can just give us your views on the clashes that we saw yesterday.
Can you hear me?
I can hear you, Minister. You can go ahead.
Yeah, no, I'm saying that it wasn't a pretty scene because to arrive at the hospital and find that there are people who are blocking the hospital entrance, it was really unacceptable. And, you know, we needed to understand firstly from the police because the province had obtained a court order to remove the people there. But there was some, you know, hesitation from the police also in terms of their understanding of the order from the court. But ultimately, of course, while we're still discussing with them, there was some outbreak of clashes between the Dudula and the EFF. But subsequent to that, we then decided that we should engage the Dudula people because they were the ones who initiated, you know, the whole problem. The EFF was apparently reacting to them. So we then met with them in the afternoon, and they outlined what their complaints were about the fact that they believe that foreigners were being prioritized in terms of consultation for medical consultation at the hospital, that they were bribing officials. This was the kind of allegations, and that therefore they are being prioritized. And the local residents find it difficult to get attention, and also in terms of when they have to be admitted to the hospital. So we then engaged with them and said to them, look, some of those may be you know, an impression, but when you go deeper, because we know that the hospital is under pressure. It's been there for 50 years. The population has grown, so it may look like because there are also people from outside the country, they may be making it more difficult. But we need to engage on these matters, and that the hospital management is available for discussion. The province is available. National government. From our side, we are available to engage and look at where there might be certain impressions which, in fact, can be cleared. And on the basis of that discussion, they then agreed that they will stop blocking the gates and demonstrating so that we can get into engagements, yes.
You emphasize that perhaps this is an impression, but it doesn't necessarily mean that it is a fact. Will there be an opportunity for the hospital to perhaps share data with them insofar as the number of people that come in there and their nationality? What is the next way forward? Because if you're saying there is an impression, but it needs to be clarified, would that be the next step for them to perhaps have engagements beyond the one that you had yesterday?
Well, I must admit that their national leader did ask whether we will be able to then clarify that in terms of the amount of pressure as a result of foreign nationals. We said at the current moment, that's not a requirement in terms of the statistics of the hospital. So we and even when we were able to arrive at a situation where we have that kind of data, that would not be the primary reason. Our approach is that residents are entitled to get health services, South African citizens, but also on an emergency basis, anybody who is within the borders of the country. So we know that that is their primary focus, but our primary focus is to provide services. So we want to engage in the situation where, because we are obliged by the constitution of the country to provide services for anybody, especially on an emergency services who's in the borders of the republic. But if there is an allegation that is prejudicing local residents, that is a matter which we can be able to look at and make sure that the allegations, including corruption, can be addressed. because ultimately we were obliged, anybody who seeks medical help must be attended to, especially on an emergency basis, but nobody must be disadvantaged, whether they are local residents or maybe they are visitors or whoever, on whatever basis they may be in the country. So those are the kind of engagements which we are going to be having with the organization Dudula.
And then on the law enforcement side, you started off by saying that your interaction with them was interrupted by the clashes that then ensued. Did you eventually establish why it was so difficult for them to effect that interdict?
Well, there was clearly a difference in terms of interpretation of the court order by the police commander from the Atteridgeville police station. But as we went through the court order, we clarified that the order was very specific, where it said that the people who are gathered at Kalafong hospital entrances must be dispersed. And we said that if there are any misunderstandings on that, we give. That's why I said that by the end of the day, because we then said that from our side, if they have any other hesitation in terms of understanding the court order, we give them the next few hours to get from their senior people to clarify. And also from our side, I instructed the DG and also the representative of Gauteng to get everybody who might be useful legally to explain, to help the police to understand the order from the court. But of course, at the end of the day, once the Dudula leadership gave an undertaking that they were actually going to stop from any obstruction at the entrances, and they will not be coming back in terms of the demonstration. Then once there was that kind of undertaking, it therefore did not become any necessary. And what we will be monitoring today is for the implementation of the undertaking which we got from the leadership of the Operation Dudula.
Most certainly, but also quite worrying if SAPS officials will be unable to interpret a court order, because they are law enforcers. In most instances, they are ones that are then expected to effect some of these orders. So it's very concerning. Hopefully in future they'll get clarity beforehand, because the impression that was given, at least on the front of society, was that they were fine with what was happening at the hospital, and some even thought they were acting in concert with Operation Dudula. I'm sure you would have seen some of that or heard even on social media that some who raised concern were worried that the police are doing nothing. But now that we established that they misinterpreted an order, it's even more worrying that generally they would be ones that work very closely with judicial officials. So it's very concerning in that respect. But another thing, Minister, is perhaps the appetite. Appetite on the front of the portfolio. Are there any conversations that you are starting with your foreign health counterparts about the impact of migration on your resources?
Well, that's another matter which I've said that now that this matter is right in the forefront of everybody in the country, we have to start the process. I mean, it's a matter which has been discussed at various forums, but in terms of action, in terms of what steps need to be taken to make sure that there are particular interventions, this is what has been lacking. So what I've said is that we will now follow up, make sure that there's very specific information, very accurate data, which we can then, together with all our MECs, we will then be able to discuss as to what are what do we propose to our national cabinet, so that through our Department of International Relations, when we meet at SADC, but it must first be, whatever we propose must first be approved by a national cabinet. And once that happens, then we'll take it to SADC, where we'll make very specific proposals in terms of how to work together in the region without overburdening each other's services.
All right, Minister, now before I let you go, we cannot let you go without speaking a bit on COVID. The World Health Organization continues to warn against dropping our guard or having a more cavalier attitude towards the pandemic, since the numbers are decreasing, particularly in our country. But we've also had an expert that has warned of another possible wave in the future. Where do you stand on this?
We have said from the time when we reduced the restrictions, when we actually lifted all the restrictions, we said that we remain vigilant. Our National Institute of Communicable Diseases is still monitoring. We don't report on a daily basis, but we do get weekly analysis of where we are. We also get the reports from our genomic surveillance network. They tell us, I just got the report last week, in terms of any new variants which might be on the horizon. So we continue to monitor. We monitor the infection rates. We monitor any changes. And that's far, what the reports which I've been receiving have indicated that thus far there has not been any change in terms of the epidemiology. So at this stage, but we know that it's not saying that we are safe forever, but we are monitoring on a regular basis. So if once there is any change, we will be able to alert the country to say, this is the situation, this is the risk, and if there's a need to bring in some changes, we will be ready to do so.
All right. Minister Phaahla, thank you very much for your time this morning. That's Health Minister Joe Phaahla.